evidence. We need more research into benefits. We need more evidence about risks. And you know what? They're right. They're absolutely right. We do need much more evidence about the benefits of medical marijuana. We also need to ask the federal government to reschedule marijuana to Schedule II or to deschedule it entirely to make that research possible. We also need more research into medical marijuana's risks. Medical marijuana's risks. We know a lot about the risks of recreational use. We know next to nothing about the risks of medical marijuana. So we absolutely do need research. But to say that we need research and not that we need to make any changes now is to miss the point entirely. People like Robin aren't seeking out medical marijuana because they think it's a wonder drug or because they think it's entirely risk-free. They're seeking it out because the context in which it's delivered and administered and used gives them the sort of control they need over their lives. And that's a wake-up call we really need to pay attention to. The good news, though, is that there are lessons we can learn today from those medical marijuana dispensaries. And those are lessons we really should learn. These are often small mom-and-pop operations run by people with no medical training. And while it's embarrassing to think that many of these clinics and dispensaries are providing services and support and meeting patients' needs in ways that billion-dollar healthcare systems aren't, we should be embarrassed by that. But we can also learn from that. And there are probably 3 lessons, at least, that we could learn from those small dispensaries. 1, we need to find ways to give patients more control in small but important ways, how to interact with healthcare providers, when to interact with healthcare providers, how to use medications in ways that work for them. In my own practice, I've gotten much more creative and flexible in supporting my patients in using drugs safely to manage their symptoms. With the emphasis on safely, many of the drugs that I prescribe are drugs like opioids or benzodiazepines, which can be dangerous if overused. But here's the point. They can be dangerous if they're overused, but they can also be ineffective if they're not used in a way that's consistent with what patients want and need. So that flexibility, if it's delivered safely, can be extraordinarily valuable for patients and their families. That's number 1. Number 2, education. Huge opportunities to learn from some of the tricks of those medical marijuana dispensaries to provide more education that doesn't require a lot of physician time necessarily, or any physician time, but opportunities to learn about what medications we're using and why, prognosis, trajectories of illness, and most importantly, opportunities for patients to learn from each other. How can we replicate what goes on in those clinic and medical dispensary waiting rooms, how patients learn from each other, how people share from each other. And last but not least, putting patients first, the way those medical marijuana dispensaries do, making patients feel legitimately like what they want, what they need is why, as healthcare providers, we're here. Asking patients about their hopes, their fears, their goals, and preferences. As a palliative care provider, I ask all of my patients what they're hoping for and what they're afraid of. But here's the thing, patients shouldn't have to wait until they're chronically, seriously ill, often near the end of life. They don't have to wait, they shouldn't have to wait until they're seeing a physician like me before somebody asks them, what are you hoping for? What are you afraid of? That should be baked into the way that healthcare is delivered. We can do this, we really can. Medical marijuana dispensaries and clinics all across the country are figuring this out. They're figuring this out in ways that larger, more mainstream health systems are years behind. But we can learn from them, and we have to learn from them. All we have to do is swallow our pride, put aside the thought for a minute that because we have lots of letters after our name, because we're experts, because we're chief medical officers of a large healthcare system, we know all there is to know about how to meet patients' needs. We need to swallow our pride. We need to go visit a few medical marijuana dispensaries. We need to figure out what they're doing. We need to figure out why so many patients like Robin are leaving our mainstream medical clinics and going to these medical marijuana dispensaries instead. We need to figure out what their tricks are, what their tools are, and we need to learn from them. If we do, and I think we can, and I absolutely think we have to, we can guarantee all of our patients will have a much better experience. Thank you.